so tired of walking, but we can't find a way back home. Can't find a way back home.
Well, good evening, everyone. Thank you so much for joining us tonight here for 40 Years, a Look Back, a special evening of stories, reflections about where we are today and the hopes for the future. My name is Dr. Tyler Termier. I use he, him, his pronouns, and I proudly serve as the Chief Executive Officer of Cascade AIDS Project and Prism Health. I'm sure we are all super familiar with this virtual space by this point in time, but just letting you know that we are in a webinar format tonight, so you are muted currently, but you will be able to unmute during the audience Q&A towards the end of our time together. You can also enable your closed captioning by clicking the closed captioning button at the bottom of your screen. And you can submit questions at any point to the question box by clicking the question button at the bottom of your screen. I am so excited to be joined tonight by some of the amazing faces and people of CAP's history, past, present, and future, people who I consider part of the CAP family, but also colleagues and dear friends. You'll get to hear from them throughout the evening tonight, but I have the honor of doing some quick intros of who they are and what they've meant to me in my personal and professional life. So just quickly, starting with my dear friend Judith. Judith Rizzio has worked in this field for the entirety. She is a milestone and such an important pillar in our movement's history, working for both our house and Cascade AIDS Project over time, a community activist, a philanthropist, and a fashionista. We're so excited that she can be here with us tonight. Mm-hmm. We're also joined by Michael Kaplan, former CAP executive director, but champion for our cause and our movement. Michael and I have had the chance to work together throughout our careers in various spaces, and I have been honored to be an executive director to follow in his footsteps here in Oregon. Cliff Jones is one of the first people I met in Portland. He facilitated a meeting of executive directors that I like to think of as a support group, which was very helpful in my early tenure at CAP. But more importantly is an incredible champion for justice, equity, diversity, and inclusion work in our community, and is a longtime family member of the CAP world. Dr. A is joining us today. It has been wonderful to see her journey. We worked together very early on in my time at CAP. Lost touch with one another for a while, but it has been really amazing to reconnect throughout the pandemic as we have been fighting for racial justice and equitable access for Black folks in Oregon. So happy to have you here with us tonight, Alayo. And Rob Lawrence, our dear friend Rob, who is a current CAP employee, who has helped us forge new relationships with Urban League of Portland and has been an amazing addition to the CAP family as we continue to not only support Black folks in our region, but ensure that folks are gaining equitable access to the housing and support services that they need to live and thrive with dignity and their disease. As we get started this evening, I'd love to just ask a first question of each of you, perhaps starting with Judith. Could you briefly share how you've been connected to HIV and AIDS work over the years and why it's important to you?
Of course, and I'm so happy to be here with everybody. I started the work as an activist, and very early on, one of my first dearest friends who died from this died in 1979, 80, and we didn't know what the heck that was about, and it was scary as hell. And I had many friends who were dying. They were performers. They were out of the acting community. Anyway, but in regards to our house and CAP, I was at both of those places in my life, and I did work with them over a period of 28 years. And in the early 90s, I had my own business along with Jillian Davis called Positive Approach. And I did education work for the city and for Portland Public School. Stop there.
Thanks, Judith.
Yes.
How about you, Michael? How are you connected to this work?
I would say most connected when I tested HIV positive in 1992. But at that time, I was doing what we used to call lesbian and gay youth work. Now we say queer youth work, and it includes bi, trans, and much more inclusive. And when I had first tested positive in 92, I was fairly adamant I wasn't going to get into HIV. I felt like eyes were turned there and not enough focus was happening on just healthy development for queer youth. I did that for a few years, living positive, and then I sort of got sucked into HIV work, saying you can't be positive and not be involved in community planning or this or that. And I also learned you couldn't do one without the other, right? I mean, queer youth were being impacted hugely, and you couldn't do HIV work without thinking about that. And so I've stayed in it for about 26 years. It's a decade of global work, very fortunate to have experienced work in Africa and Latin America, thrilled to have the 4 years in Oregon. And also thrilled in the last 5.5 years, learning I could work outside of HIV as well.
That's great. Rob, I'll turn to you. How are you connected to this work and why is it important to you?
I'm connected. Well, I first started with Brother to Brother. I started as a volunteer. It was a time for me to walk out. I was able to walk into this room and see strong gay Black men that sort of took me under their wings and sort of educated me around HIV and AIDS. And I got really serious about it when a really good friend of mine passed away in 1994. And I just didn't like the way he was treated in the community. So I started volunteering more with Brother to Brother, sat on the board of Brother to Brother. And I had people like Cliff Jones that, like I said, that took me under his wings and helped me. So people like Cliff are the reason why I still do this work.
Thanks, Rob. And great segue to Cliff. How are you connected and why is it important?
Well, I was going to mention I met Rob at Brother to Brother, and so a part of my involvement was through Black people and how both the virus was impacting Black people and how access to prevention information and healthcare was impacting Black people. So lots of work with Black people in the community, building up Brother to Brother so that Black gay men would have a culturally specific place to go. But really, originally it was being a gay man in the community and, just terrified as we didn't know what was happening and watching the larger systems begin to stigmatize us and blame us and not provide research or care, and then watching watching all the mobilization that happened in the gay community, watching lesbians really stand up and step in and support. So it was just incredibly inspiring and heartbreaking and terrifying to move through that time period with this cohort of people. And I also was on staff at CAP for about 3 years. So really lots of touch points in my life, really critical to my development.
Thanks, Cliff. How about you, Dr. A?
Sorry. I think it really started for me. I have multiple siblings. 3 of my brothers are gay men, and they are all 3 HIV positive. And I needed to figure out why. because we're all proximal in age. And if they're HIV positive, why am I not HIV positive? And like, we're doing, you know, same home, family activities, what's different? So that was my touch point into the work, parallel to working as a, directing a teen parent program and talking to high-risk youth, who we societally call high risk, but in the HIV world, they were high risk as well, and not knowing that. And so like bringing that to like, you don't know your HIV risk. I don't know why I don't have it, considering my history at the time. And let's unpack this because we don't talk about women in HIV, or we didn't at the time. And so that's my touch point in this work. It started with men in HIV that I love, and to why not me, and how do I make sure it's not me? Because I, you know, not from a stigma place, but I want all these things. And then, you know, I end up with diabetes, which, you know, was the goal. I found out at one point to let's make HIV a chronic manageable disease. And I was like, that's awesome, but diabetes sucks too. So my brothers and I lament that our medications are probably similar in that way. But yeah, that for me is what brought me to this work and keeps me in it.
What I love about this as an opening question is we all come from different places in life. We all have different positionality, different privilege, but something a friend of a few of us says, our friend Paul Kawada, is that this work finds us. Something happens in our lives, and that that work changes you. And whether you stay working in the field or not, it is a part of your life and will always be a part of your life's mission, whether it is your day-to-day job or not. So I appreciate all of those beautiful answers. Let's think about this moment in history. So when you reflect on the last 40 years of HIV and AIDS in this country, what comes up for you about that history? Let's start with Cliff.
What comes up for me about that history? One piece is saving lives, you know, just the saving lives, that simply. And also, as I mentioned earlier, the homophobia and gay oppression, just the way it became so visible in that period. But also lessons for COVID. You know, I feel like we prepared the world for how to respond to a pandemic, and we also prepared Dr. Fauci. You know, ACT UP prepared Dr. Fauci and he actually thanked the gay community. But so, you know, I just think about a worldwide impact and how we're all impacted differently, and just learning how to survive. And the last thing I'll say is facing death. Any of us who have worked in this field, we've learned how to reconcile or just face death. You know, I mean, I lost so many people that you know, my relationship with the dying process is really much, much more understanding, connecting than it would be. You know, I just actually talked to a friend and just made some suggestions about how they deal with the death of a family member. So those are some of the things that come up for me.
How about you, Dr. A? What comes up for you when you think about these 40 years?
I was trying to do the math on what percentage of my life that is. So like listening to Judith and Cliff and Michael, just from the perspective, I'm just sitting here enthralled. What comes up for me is warriorism and resilience and just how much respect we actually owe the folks who have come before us, and how I don't think they often get it or hear it, even a thank you, which could be too small. Cliff talking about facing death and how we've all, because of our work in this field, been able to do that. Some of us at much greater degrees than others. It's overwhelming. That's where I'm at right now. Like, even in this moment and listening to just us as a panel, I'm already just like, thank you is too small, and but that's where I'm at right now. It's impressive, the resilience of human beings in the face of, but wishing it didn't have to be in the face of. So that's where I'm at. So.
Yeah, I think we have learned throughout these 40 years that it taught us about resilience and prepared us for how to survive. Our community knows better than anyone how to survive a plague. And here we are in the midst, emerging from another pandemic in our lifetime, and stronger for the first one that we fought our way through. So thank you for that. How about you, Judith? Big question, 40-year reflection.
Yeah, definitely the tenacity and the will to live despite what was happening. The work at Our House, for me, I was there over 17 years. I experienced close to 400 deaths that occurred during that time in this small facility, and watching the families and the immense love, and also the brutality that came with the disease itself, and trying so much to stay present as someone helping people deal with this, and yet watching the world not giving a rat's ass at times was blindingly hard for me. As a mother, as an activist, just as a person. But I have to tell you, it brought an immense sense of beauty into my life, despite it all. And that, to me, is something that we don't talk enough about, was what was created from facing such hard things. And it all was happening at the same time, horrific things, immense beauty, and the impermanence of life, but even more important than to fight for it.
Thanks, Judith. How about you, Michael?
40 years. Wow, I was just 13, bar mitzvah. And I was in Kansas back then and thinking, this ain't my world. And I was a closeted little queer boy in Kansas, a little queer Jewish boy, to even be a little further out in Kansas. But when I think about the history, I also think about 92 when I tested, and AZT being the only treatment. And I think about the way the medical world has changed because of HIV. So for the last 5.5 years, I work in cancer with lots of other cancer organizations. And often, whether it's cancer or any other disease state, HIV is the frame in terms of how patients get activated, or whatever, whether you want to use patients or whatever, in terms of engagement, in terms of not willing to sit back, in terms of the ACT UP, in terms of fighting, in terms of making sure we had clinical trials and that you're involved in clinical trials. And it's still falling short in terms of the racial equity in clinical trials. But there is this continuous fight in HIV that I think, for me, always gives that message of that which does not kill us makes us stronger. And as horrific as I think about all the people we've lost, more than I can remember, there has been a lot that has been achieved to this unfortunate, whether it's about patient involvement, or I think about the infrastructure of the queer world today. I think much of that was built on the back of this epidemic, and I don't know that they recognize it as much, and at times I think they've stepped away when they should have had more responsibility for stepping up. But it's been an interesting several decades.
Yeah. How about you, Rob?
Sort of like Michael, I was a young teenager 40 years ago. And, I thought back then that this would never touch my life at all. I remember watching Ted Koppel on Nightline or the evening news saying this is going to touch everyone's life. And I was like, there's just no way that this is going to happen. And then fast forward, yes, it did touch my life. And thinking about all the people that I've lost, I think about the work that Brother to Brother did. I think about, walking into that room with all these strong Black men that they told me that it's okay to be Black and gay, where from my community, that wasn't okay. And so also I just think of the progression around the disease as well.
Yeah. From my perspective, I have never lived a day where HIV wasn't a part of our world. And yet it still wasn't a part of mine until my own diagnosis in 2004. It wasn't something that I heard about. It wasn't in my family unit, something we talked about. And my first introduction to understanding the impact of the epidemic was being told that I was now living with this disease. The power, I think, of this conversation and the evolution of this 40 years is in 2004, I was not handed a death sentence. I was told my diagnosis. It was very difficult for me to figure out how to then disclose my status and to deal with the stigma that still exists related to this disease. But I knew in that moment that with the right support, with the right access, I could still live a long and managed life. So I do think it's important to acknowledge that we've learned so much in this 40 years that we're dealing with a very different disease while we honor how hard those early days were and how much stronger we are today because of the lessons we learned early on. Let's do some specific questions for each of you. Maybe we could start with Judith and Cliff. For decades, both of you have been community leaders and activists in the AIDS movement. For people who may not know or don't remember, can each of you just give us a snapshot of what it was like in those earliest days of the movement?
I'll start.
Go for it.
I mentioned that in 1976, I trained doing political theater with the San Francisco Mime Troupe and many other groups, including a group called the United Fruit Company, which is a takeoff on a gay liberation theater company of gay gentlemen, and they were fantastic, and we were fast friends. Early on, there were 13 of them. By the end of, the 80s, only 11 of them, 11 of them had died out of the 13. And I remember just as each one went, it was so scary. It was crazy. However, that's when I dove in, and I just want to remember a story that's so important. My first day being employed in 1988 by Our House, I was given a set of keys, and they said, "Go to this apartment. That you're going to find in there a apartment that was left 3 months ago by someone that they wheeled out who had died in the apartment." And he left all his belongings. I went in, I opened the door, and it was as if I was seeing what the face of this disease looked like one-on-one. And it was, obviously this person was trying to survive, and there was medications, and there was, obviously he was trying very hard to keep going. I saw journals, and I saw this and that and the debris, and I just remember sitting down in the midst of it and crying and thinking, okay, Judith, you wanted to do this work? You know, what the hell did you think it would look like? And, you know, out of all the stuff there, I brought back a headboard that was behind his bed, and it was beautiful. And we used that headboard as one of the first rooms that we opened up at our house. And it was from, you know, it was from that, at least for me, in a macro way, I realized what the face of this looked like. Cliff.
Cliff.
Thank you, Judith. Well, so I'm just flooded with thoughts. One is ACT UP, AIDS Coalition to Unleash Power.
That's right.
So both the gay community understanding we had to develop agency. We had to fight collectively, both the political system and then the way the community mobilized to take care of one another was just unbelievable. It's like in the face of people dying, people brought food, people took care of people. You know, we built support systems before there was any agency to coordinate that. So that kind of spirit and power, you know, I think it was, we didn't know our own capacity and we discovered it because we had to. Another thing I'll add is, you know, in the midst of this, in the late 80s, early 90s, there was this political assault on gay people. There was a series of anti-gay initiatives that were just, it was just devastating. It's just like, hit us while we're down, you know? And we also rose to the occasion around that. So it's like, we had to become strong. I want to mention what people might not know is the community that was developed among Black gay men in this region. And, you know, I know Rob because of Brother to Brother. And I remember Rob marching with the Brother to Brother banner in Gay Pride. And we're talking about, what if we end up on news on TV? You know, we're just struggling with what does it mean to be a Black gay man in this period? And how do we come together and support one another and do new things? How do we reclaim our right to be and live with dignity? And just two more quick things. One is the quilt, another incredible response to support the community to grieve. Thousands of panels that people would make to remember their lost loved ones. And I remember the first time it came to Portland at University of Portland, and we would read the names of people that had died. And I remember reading names and just sobbing, you know, just we learned how to grieve and take care of each other. And the last thing I'll say was, when I was on staff at CAP, I was the education coordinator, and the person I replaced was very ill, Randy Ponce, who died shortly after that. But I remember he had had a rough night, and we went to see him in the hospital. And we were sort of out on this fire escape because it was sunny, and we were crowded around him. I'll never forget, he said, "Do you know what it's like to have someone fight for your life?" He said, "I almost died last night, and these doctors were fighting for my life." And I just never forgot that. So we just, you know, we were full of just living on the edge together.
I appreciate you mentioning the quilt. I think it is such a powerful, it's such a powerful image and such a powerful experience even today when you get to experience the quilt, especially for those who may not have been around during those toughest times. They can see the lives and the history and the pain and the beauty of so many that we lost during that time and over time. One of probably the most profound and memorable parts of my career was when the International AIDS Conference returned to the US for the first time after the travel ban was released. And at the time, I was chairing a board of directors in DC and had the honor of introducing the quilt at the opening of laying it back down on the mall. The horrific and sad portion of that is that by that point, the quilt was so large, it would no longer fit just in the mall. It was spread throughout the entirety of DC across lawns and other museums. So thank you for that beautiful piece of our history. As a little heads up, there will be a piece of the quilt or pieces of the quilt at Multnomah County Health Department to honor World AIDS Day coming up on December 1st. Let's pivot over to you, Dr. A. We know that here in the United States that once HIV and AIDS sort of dropped off the front page of the papers and in the media, a lot of Americans thought, okay, we're done with that chapter. But as your work certainly has been a testament to, there are still specific communities and populations of people where we've not figured out how to solve this for in the US. Can you tell us a little bit about where HIV is still prevalent in America?
Well, thank you for the question, as big as it is. My first thought when I was listening is Black people, and then women, and then the ease with which we invisibilize other BIPOC folks in the whole BIPOC spectrum. That's where it's most prevalent. My research, of course, focused on adolescent African-American females, women in general, and in that research, really seeing some stark things across the entire reproductive span. Black women are number one in HIV among women. And that's telling. And then you look at women in general, and it's women over 50 and women under 19, 19 to 13, being these higher risk groups. And you have to get into the why, which validated my initial why not me with my brothers, but also makes it even more of a question, why not me, given the risk that we have as just, gosh, there's so much. Population size for women compared to our rates of HIV in this country, disproportionate, like Black men, disproportionate, like we're just 61% of women with HIV are African American compared to 11.8% of the population at large. It just doesn't make sense. And so we have to ask ourselves why. And so that was my research. And in talking to these girls in Oregon, where we're mandated to have comprehensive sexuality education, these students could not remember having it, specifically students of color. You're supposed to have it 4 times between K through 12. I don't remember that. I didn't learn that. I didn't know I was at risk just because of my gender or my ethnicity. So something's not happening, and we have to look at that. So that's my answer to your question.
Thank you. I think like many disease burdens, we recognize that the same groups of people often come up in this conversation. The people that have traditionally been furthest from opportunity in our country, that continue to have inequitable access to healthcare services, resources, food, you name it. So I appreciate you calling out and naming those specific groups. Rob, as we think about those communities that Dr. A just mentioned, I'm wondering if you could talk a bit about the issue of stigma, because that seems to still be a pretty big impediment to getting people into care and getting good care to the people that need it.
Thanks, Tyler. Yeah, so there is still a huge stigma in the Black community. There is stigma within the church. A lot of us were raised in the church. We all, as African Americans, have heard that sermon of God made Adam and Eve and not Adam and Steve, and that we're all going to go to hell. prior to doing the position that I'm in now, it was a collaboration between Urban League and CAP. I was the African American HIV Services Navigator. So it was getting people connected to care in my community. A lot of them, it was hard to get them to see their physicians because of the shame, the stigma. I think one thing that we need to do with other organizations is that we need to start hiring more people that look like us. So when they come into an organization and it's, they're looking for culturally specific services, there needs to be someone there that looks like them, the African American or the Latinx, the Asian community, to connect them with to care. Also, being in that position, you have to be a really good advocate. So I was a really good advocate for my participants. So I had a situation where I took a participant to the doctor who, didn't want to go to the doctor, but was like, we're going to the doctor. And the doctor prescribed me new medication. And so that he asked the individual, do you have any questions? And this client was like, no. I said, well, I do. You prescribed him new medication. So is this going to interact or interfere with any of the other medications that he has? And so the doctor was like, oh yeah, it is. So he had to change the medication. So when I was in that position, I was just like, really, you have to be an advocate for yourself, because if I'm not here, you need to ask these questions. You need to have a conversation. That is your time with your doctor. So yeah.
One of the things I love about Rob Lawrence is from the day that I met him, he has always been very direct and very honest with both myself as a leader at CAP, but also with who we are as an organization, where we have definitely not done the right thing or shown up in the ways that we have needed to, but also has been a really strong partner for us in making sure that we're doing everything we can to both acknowledge that in an ongoing way, but commit to doing better and actually doing better. So it's been amazing to have him now join our staff at CAP.
Thanks, Tyler.
Let's go over to you, Michael. In regards to those particular communities that we've now been talking about, you often hear this term that they are hard to reach populations, but I've heard many activists say it's not about being hard to reach, it's that we know what works. It's just a function of finding the political will to do better. Do you agree with that assessment? And what role do you see community-based organizations playing in turning this tide?
Yeah, I mean, I agree partially, right? I agree that I think hard to reach is a bullshit label. I think we can say failure of outreach and that we were insufficient in our reach and that we didn't, but to say hard to reach puts it on the people we're not reaching. And I think, it's a lot of it's pretty basic. It's if you want to engage, this is a social disease of networks. We look at networks. Do people see themselves in the places that are trying to engage them? Are we going out? I think CAP, I remember, we used to have outreach workers doing testing in sex clubs and getting on Grindr and on apps. And I think you have to go and be ready to be where the population is. And you have to ensure that who you're trying to reach is, that you're represented in that. And I think sometimes the challenge, on political will, whether it's political will, community will, agency will, I don't know. I frankly don't think it's the job of politics as much as community and agency will. I do think politics gets in the way. I think about our global AIDS response. And I remember when PEPFAR, the President's Emergency Plan for AIDS Relief, started and had, if we were going to end this epidemic, you have to focus on those most impacted. And in much of the world, that would have been sex workers as well. And the politic there was, no, you have to condemn sex workers. And so I think sometimes the systems and the politics will put in barriers. I think community-based organizations are the front line and have to make sure that those they seek to reach see themselves at the agency, and they don't expect people to come to them, but they figure out how to get out there. That's my thoughts.
Thanks, Michael. A couple of questions that I'll just throw out and see which one of you wants to answer. First, we've come a really long way over the last 40 years, but the work that we have ahead of us is not done. So what do you think are some of the major challenges that we face today in ending HIV transmission? And do you think we have it within our power to end the HIV epidemic? Thoughts?
I'm going to offer a thought, which is, I think, so I'm going to talk for a minute from the Beltway, because I've been living in DC before I went to CAP and after CAP. And I see all these national organizations, and I used to run one, AIDS United. And my experience is a lot of these groups are talking to themselves and each other and not getting outside of that. I spent 25 years as an HIV positive queer man working in HIV and queer justice issues. And sometimes I have said, living my life as an out queer HIV positive man outside of that bubble in the main world has helped bring that further out. And I think it's partly how do we get beyond our bubbles and how do we normalize and not make it just these small conversations is a huge part for me.
Others have thoughts? What are some of the major challenges we have yet still ahead of us?
I think the thing for me that is very frustrating is the same things that we talked about before. I mean, right from the beginning, the stigma, the disparity of who gets what and how much of it, and it is one of these things that sometimes when I talk to younger people as well, the fact that it isn't even discussed as something to be learned from or understood. And I'm not talking about how you get it and not get it, but how it was a part of our history and still is in regards to how we dealt with treating one another during times where we needed to reach out to everyone, and it did not happen. It just did not happen. And it still isn't in many ways. And so, I have no answers to that, but it is a thing that sometimes I find myself, fist in the air saying, what have we learned at times?
Yeah.
I think in my specific research vein of this, we're at a time where Black nationalism is international. And so Black girl magic is not just this something we say amongst ourselves in private anymore. It's loud and proud. And as women, particularly Black girls, are able to advocate for themselves and see what they aren't learning, they demand to learn it. And my research was around creating peer-based training so that they train themselves and they are their own, they're the one at the party who says, no, you standing on your head will actually help you get pregnant rather than prevent it. Gravity, use your brain type of conversations, because they would say that stuff. That gives me hope that we're at a place where they can be comfortable, because it's not just HIV. When I talk about that, it's the school system. It's the politics that we're still seeing. I feel like we're going to get some needle move that's permanent in our lifetime, and that's like super hopeful and exciting for me. That's what I see. I'm looking at who's taking up the mantle, so to speak.
Yeah.
I would also like to say one of the challenges that I'm noticing is, especially in the Black community, is access to PrEP. A lot of hospitals, doctors are creating these barriers for African Americans to receive PrEP. I had my own experience with trying to receive PrEP. They put up all these barriers, and I was like, you know, if you're doing this to me, how many other African Americans are you doing this to? So I just think as an HC, you know, we need to start talking to physicians more and see how they can break down these barriers so people of color can have access to PrEP.
And I'll just add quickly, I think there's always an upward trend and a downward trend that they coexist. And our work is to make sure that the upward trend has enough energy, vision, people behind it, that it overcomes the downward trend. And I think that the impact of health disparities, like Rob was just talking about, make the end of HIV challenging. And so it's really those kinds of programs that create access. There is enough resource for everyone to have good health care. And unconscious bias, you know, just all these things that coalesce to create disparities. And so I think both of those things go hand in hand.
Yeah, I think for me, you know, we have had the tools and the knowledge to end HIV for a while in a lot of respect. You know, we have the tools in the tool belt, but we have to do many things for this to really work. We need to make sure that people have equitable access. We need to ensure that we can end HIV in the Southern United States and not just stay so siloed in our own buckets and roles, which is why CAP often joins the more national advocacy efforts. And we have to find a way to end all of the other drivers of the epidemic, or find ways to best address those so that the people who continue to seek care have access, and those who have always been at a more disproportionate impact finally one day will be in a better place in so many different aspects of their health and well-being. We have a question. We have a question in the chat that I'll throw out to the group here. Because the younger generation has not been a part of the HIV/AIDS movement when it was a death sentence to be HIV positive, do you get a sense that they don't think it's a big deal to get HIV now?
I'd say yes.
I mean, I've actually heard that being said in regards to, like, you know, so if I get it, you know, I'll just get on the medicine you need to take, and it really is something that I don't need to necessarily worry about. And you know, the simplicity of that statement, you know, I find myself, I have to hold myself back just wanting to say, well, first of all, let's just talk about physically what that will do to your body. And then I just, you know, but that's a bit sobering. And I think that thought is out there.
Yeah, I often think about how we in our movement made such a concerted effort to swing the pendulum away from the fear and the hatred and the discrimination that in some ways people became complacent. The media stopped talking, and all of a sudden now we have a generation of folks that have, like myself, not lived a day where HIV wasn't here, but also have never lived a day where HIV wasn't a very manageable disease, that it wasn't considered a long-term chronic illness, and don't know firsthand the severity of the impact it can have on your life, and haven't experienced the same loss that so many did early on in the pandemic.
I also just want to say, I want to give thanks that actually for young people today, it isn't the same story. They can live with it. There are treatments available. In the US, it's hard not to find a program that will make sure you have access. And they do look towards a future. And so I give thanks for that too.
Yeah, I did my doctoral research on interviews with HIV clinicians, trying to understand their viewpoints on the challenges that young people who were born with HIV experience in transitioning from pediatric to adult care. And I often think about that group of young people themselves, also long-term survivors, although we don't always talk about them in the same way, but many of which have lived their entire lives, are resilient people, have been aging with the disease, and have so many lessons that I think that they could even teach the generation today, although they're kind of an unspoken part of our journey often.
And it reminds me that we have work to do around esteem, you know, and what are the ways that gay oppression still marginalizes us, and in some part of our brain. Because if we care about ourselves deeply, for me, that results in caring about our health and one another's health. And so, you know, I think the impact of gay oppression and other forms of oppression, you know, cause us to not hold ourselves in the highest esteem.
Yeah.
I just want to say, though, I'm very excited about what's happening with younger women who are finding themselves being able to take control of how they want to be in the world sexually or not.
Mm-hmm.
And that's why it's so important to keep the fight up in regards to reproductive rights, and having that available for everyone, be you whoever you are, and the fact, though, that it is something that is changing in regards to the power that it can happen around how and why you get infected at times. So that is a very positive thing.
Yeah. I have so appreciated our time together tonight. I always love getting to see the faces of CAP's history. I always believe that once you're a part of the CAP family, you remain in some way. We can pick things back up when we run into one another, and it has been such a joy to spend time with each of you tonight. We are going to close out tonight by answering one final question, which is, what do you see for the future of HIV and what gives you hope? Let's start with you, Michael.
I'm going to be controversial for a second, and I'm not threatening CAP in any ways, but I see eventually the future of the end of the AIDS service organizations and the AIDS, and seeing wherever I get my help, my HIV will be cared for just as much as every other part and everything else I'm dealing with.
For sure. How about you, Dr. A?
That's beautiful. Through the women's conference, we were always trying to normalize testing. So it was right there with the glaucoma testing, HIV test. So Michael just hit the nail on the head for me. Like, when we don't need CAP, or when we have spaces that are just openly supportive of people, being people who want to convene, and those people are able to bring their whole self and whatever that may entail, status, sexual orientation, etc. And it's just an affinity group of people who wanted to get together rather than some stigmatized space that we have to back away from. That's my hope.
How about you, Cliff?
Well, I think for me, I envision a world where we center people, and where we create systems that thrive, that are people-centered, And in that world, we have a whole person approach, and we create multiple ways to support one another. So that's the, and you know, I think it's much in line with what Michael and Dr. A were saying.
Rob, what gives you hope?
Gives me hope. Well, how is the future for HIV and AIDS? That everyone's saying that we won't need any more agencies like this, like CAP or other HIV agencies. What gives me hope is the work that we're doing right now. Just having a discussion tonight about it. That's what gives me hope.
And Judith.
Well, we went to the Oregon Historical Society and checked out what was happening, because we're going to be celebrating that again. And we asked the person, so who comes and looks at these archives? Does anyone? And what gave me hope is he said, yeah, college kids are coming, and they're doing reports about the history of this and want to know more about it. And I was like, oh, that's awesome, and to continue telling the story, so that we can definitely move forward and continue it with hope. And so I have to say that, that's made me very happy that the history of this is not just something that's history, but it's still fluid and important to remember and to learn from.
Thanks, Judith.
Yes.
For me, it is the powerful activists and committed workers that have been doing this work for so long. How powerful is it that this group of people who have been connected to CAP over many decades have come together tonight to not only recognize this milestone, 40 years of HIV, to honor those that we have lost, but to celebrate the progress we have made. So my hope is that one day within our lifetime, we'll come back together as a group, because there is an end to HIV, and we can talk about how beautiful that is, and about how beautiful those people were that we lost along the way. I want to thank all of you from the bottom of my heart for joining us tonight as panelists, for being open and sharing pieces of your story. I want to thank everyone for joining us and listening in on this panel tonight, and just wanting to plug that you can always find out more about our work at capnw.org. You can also support our work by going to the donate button on that page. Thanks so much, and have a lovely evening. Bye, everyone.